thank you so much for being here. I feel as though as a newbie to the Berkshires, I don't think we could have ordered a more perfect day. So thank you to the universe for really making it possible for us to gather out here and enjoy this gorgeous day. I am Bethany Keeley. I am the new CEO of CHP Berkshires, and I am just delighted to be here. I feel a little bit like I'm arriving after all the hard work has been done. So my goal is to really acknowledge what everybody else has done to make this beautiful facility possible. So we're delighted to have you all here and to introduce you to this newly renovated, beautiful Lee family practice. So if you haven't had a tour, I'm going to encourage you to wait around for that after we're done with these few remarks. So CHP in total takes care of about 30,000 people in the Berkshires. And right here in Lee, we take care of about 5,000 people. Thanks to $1 million investment in this facility, we're now going to be able to expand our capacity and take care of even more people. When we think of healthcare, we usually think of a provider and a patient in an exam room having a sort of close interaction. But here at CHP, we think of care much more holistically than that. So we integrate nutrition and behavioral health, and we have community health workers who are here to help our patients who have any number of other challenges that are affecting their health and their well-being overall. So think about things like housing, food security, overdue utility bills, domestic violence, transportation problems, and more. It's a long list of things that our patients need in addition to good health care. Here at Lee Family Practice, we just didn't have enough space to be able to provide all the services that we're capable of and to really be focused on our mission of providing whole person care. Only 4 of our 5 primary care providers previously could be at the site at the same time, and we didn't have space for behavioral health or nutrition. We couldn't add new providers, so we were very limited in the numbers of patients that we could take care of. So our renovation didn't actually expand the footprint of the building. Instead, with a lot of creative thinking and great minds and experts, including our staff here at the site, we reconfigured the existing space. We were able to expand from 9 exam rooms and 1 consult room to 13 exam rooms and 4 consult rooms. So that significantly increases our capacity for seeing patients throughout the day, but it also improves our ability to keep things moving and help patients get through their visits efficiently. So thanks to this renovation, we are really able to see a lot more patients in a day, a week, a month. We've already hired some new staff, and there are more to come. So after several years that included the pandemic slowdown, we have finally crossed the finish line of construction. But even better, that means we're really at the starting line of bringing care to more people. It's hard to find primary care providers here in the Berkshires. There are providers retiring, and there's a lot of new demand from new residents relocating to the Berkshires. Our population skews a little bit older, and we have more residents with chronic health conditions compared with other parts of the state. So this means really that continuing to add staff and expand our service offerings is critical to help all of our neighbors have a primary care physician or a nurse practitioner. I've only been here 2 months, so as I said, I take no credit for everything that you see here. But yet I am going to say how proud I am to be part of CHP and to be here welcoming you all and sort of bragging about the facility and the amazing work that our team does here. It was a lengthy and complicated construction period, and the Lee Family Practice team and all the other staff involved, from everything I hear, maintained their good cheer, collaboration, and teamwork throughout. So a huge thank you to all the staff here at Lee Family Practice. You're sprinkled throughout the crowd here. Doctors, nurse practitioners, nurses, medical assistants, receptionists, and others. Oh, and community health worker. Sorry, I'm sure there are other titles we're missing. For your flexibility, your can-do attitudes, and your commitment to continuing to serve our patients under very trying circumstances. So thank you all. Thank you also to our patients, some of whom are here today, for your patience with the many months of disruption. we hope you're as happy with the results of all of this work as we are. Next up, I'm going to introduce Miriam Gluck, who is the Senior Practice Manager here in Lee and who many of you have met today or previously. And later we'll also hear from Dr. Melanie Levitan, one of the founding physicians here at Lee Family Practice. And we're very fortunate to have KCPs from Senator Paul Mark's office. Before Miriam takes the microphone, though, I do want to be sure to give her special thanks for her leadership and for working so hard to keep every detail, no matter how big or how small, on track, and for always keeping the interests of our patients and our team members first. So thank you, Miriam, and please come on up.
Thank you so much, Bethany. I want to start by offering a huge thank you to the staff here at Lee Family Practice, our CHP administration, and our amazing facilities team for all of the support we had during this ambitious project. We're also grateful to our colleagues at all of the other CHP practice locations and our mobile health unit team. They took our staff and our patients in when the building had to be closed for stretches of our construction so that we didn't have to sacrifice any patient care during the process. We couldn't have done it without any of them. If you ask me what I love most about our new and improved workspace, I would say our reception area. It really is a highlight for me. It's our patients' first vision of when they walk into the building. It should be welcoming, warm, friendly, and it also is collaborative with a mind for patients' privacy when they're dealing with concerns. When people have a primary care home, they're less likely to end up in the ER or in urgent care. They can have better access to specialists throughout the community and overall coordination of care. At CHP, patients have nutrition and mental health support and the assistance of our community health workers who are getting a lot of call outs today because they're so wonderful, as well as everyone else. We're so pleased that now we can say yes to more people who need health care in a timely manner. And we're so happy to share our new facility with our long-standing lifetime patients who have been understanding and patient throughout the construction. Thank you. We wish you all the best of health. And now I'd like to introduce Dr. Melanie Levitan, one of the founding physicians here at Lee Family Practice.
Hello, everybody. It's wonderful to see all these faces. I know Miriam's going to stay with us forever, but if she doesn't, she'll become a construction manager because she did it so excellently. So anyway, I was just asked to provide a little ancient history. We're not that ancient, but Michael and I did start the practice. Michael is standing right over there, sitting right over there. Raise your hand. And he definitely helped me with the years because I couldn't quite remember exactly when. But basically, Lee Family Practice as a private business, as a private medical practice, started in 1999. We were employees, and we were at a time of a lot of changes in healthcare, like now. But Michael originally worked for Hillcrest and a different CHP, which I worked for. And then we were bought out by Kaiser. Then we were part of BHS, Berkshire Health Systems. And then we became our own private practice. And we were in a very small building on Stockbridge Road that used to be a vet. And it was very funky, extremely funky. And we had a nurse practitioner, Kathy Cordy, and then Ann Humboldt joined us. I don't know if Ann's here today, but and then the building eventually was being sold. And our choice was to buy the building, which would have had lots of stuff to deal with to convert it and rehabilitate it. So instead, on a hope and a prayer, we bought this lot from the Community Development Corporation, and we broke ground. Here we are. It's Smitty Pignatelli, who you all know, and John Toole from the CDC. And believe it or not, it was October 2003 we broke ground, and in May 2004 we moved in, which is kind of a record for constructions, but we did it. And we operated here for many years, and then in 2012 we became part of the CHP family. It was quite a decision for us, but the landscape was changing again. We were going to purchase an electronic medical record, and the administrative burden was becoming more and more, to the point where we really didn't see a great future in continuing to be a small family practice. So we joined up with CHP. We got the new EMR, which was a transition, but we did it. And then we were able to expand and bring more people on. But as Miriam said, we were limited by our space, and we have psychotherapy, we have nutrition, we had acupuncture here at one point, and but we really needed more space. And I don't want to really repeat what's been said, but I was a little skeptical at first, because after all, Michael and we had corner offices. He was over here and I was in the back. I got to say hello to a lot of black bears over the years and back there. But instead of all these private offices, we have more room for patients to be seen. We have more room for collaborative care. And I actually get to work closely. The way we're working it out is a practitioner is working closely with the nurse or medical assistant who's working with them. And it's much more convenient than either sending lots of messages on the medical record or chasing the person down. So, for example, Karen, we work very closely together, and it works better. It's better for patient care. So, I was a skeptic and didn't really want change, but I'm a believer now. So there we go. Um, so I just want I wanted to welcome some of our newest providers. Sharon Bigler, can you stand up? Sharon, she's standing. Thank you, Sharon. Uh, Anthony Hamling. Anthony's a psychotherapist in LICSW. Mandy Hood, our community health worker. Lauren Young, who had to leave, but she's a new family nurse practitioner who came from the residency. She relocated from Great Barrington. Not here today is our great Jeremy Stoker, who's biking happily somewhere. But thank you, Jeremy. He joined us years ago and has been wonderful for our practice. We also have family nurse practitioner T.C. Clark. T.C., where are you? Anne, thank you. Anne Hummel, are you here, Anne? I don't know. Anne's not here, but she lives pretty far away. Janelle's on vacation, and nutritionist Devin Renzi. I don't think Devin's here either. But anyway, thank you all for being here, and we're glad the construction's over, and hallelujah.
Oh, I loved hearing that history. Thank you for doing that. And if you get a chance to come and look at the photo, it's priceless. So thank you for that history. I'd now like to introduce Casey Pease, who is the Berkshire's liaison for Senator Paul Mark and is joining us from the farthest reaches of Savoy, Massachusetts. Thank you.
Yeah. Oh, thank you for the opportunity to be here. And I know the senator sends his regards. He's in Boston, but I get to be here with all of you on this wonderful day and with the wonderful snacks and everything. So thank you for that. I was thinking about what I wanted to say here today, and I can't help but mention my mom. I grew up in the Hill Towns, and my mother's been a nurse at Berkshire Medical Center for 35 years. So I was spoiled growing up in a rural area because my primary care was my mother. But now at 26, living in Savoy, it's been really difficult trying to find primary care in the Berkshires in Western Mass. And it's the responsibility of state and federal government and partners to really figure out how can we expand access. And it is really exciting, and I'm just really honored just to see what CHP of the Berkshires been able to do. 1,500 new patients, that's huge in a county like Berkshire County. When we look at some of the initiatives that are happening, for the longest time, and you know it if you live in Western Mass, and you know it if you live in the Berkshires, Boston doesn't always pay much attention to us. And they don't understand that we have real access issues in our rural areas. And one of the great things that the new governor has done is we now have a director of rural affairs with Ann Goby, who can take the time to really put a rural perspective on how can government help. Senator Paul Mark, he is now chairing the Oral Health Caucus and is looking at ways that we can expand on oral health. And there's a lot of good legislation that's moving forward, and I think with his leadership, we're going to see really good progress. I also just want to say to all the healthcare professionals here who have gone through an awful time with COVID, and I know my sister's a nurse, my mother's a nurse, I have families that are doctors in the medical profession. It's been really difficult. But when you see the excitement and the happiness of being able to expand care and to take care of people, there's nothing more rewarding. And that's what I see every day in working in government, and I'm sure that you see it, of course, in healthcare. So I guess I'm going to leave it at that. I don't want to go too much longer, but this is a really big deal. And when you couple that with the reopening of the North Adams Regional Hospital, there's a lot of good things happening in Berkshire County with healthcare. And I know that Senator Mark is going to continue to partner and be there and support you in any way that we can to expand access. And I just want to thank you very much and offer a really big congratulations. So thank you.
Thank you very much for being here, Casey, and our thanks also to Senator Mark for his support of CHP and our communities, and would love to talk to you about dental before you leave. So I also want to note a special thanks to our vendor partners for their support of our event today, including Domainies, whom I hadn't heard of before, so I will be checking them out, Marketplace Kitchen, Columbia Tent and Event Rentals, and Limelight Productions. So thank you to them. And thank you to all of us. Yeah, thanks. Thank you to all of you for joining us. Again, just a reminder, we will have a couple more tours through the site. Be sure to enjoy some refreshments. We just have one more job to do. We need to cut the ribbon.
10, 9, 8.